The equipment is stocking net, the padding, which can be Webril, 15 cm and 10 cm plaster of Paris, trauma scissors, cold water, crepe bandages and tape. The patient can be sitting in the bed as shown or in a chair. They can be self-supporting the arm or have support provided. The final position of the arm is the shoulder is slightly abducted, the elbow is flexed at 90 degrees, the forearm and wrist are neutral, and the thumb points towards the shoulder. Estimate the plaster length by laying the dry splint next to the uninjured arm. Use 10 layers along the ulnar aspect of the arm and 10 to 12 layers for the stirrup. The distal margin is the distal palmar crease. We see the stockinette being pulled up to the proximal margin, 5 cm short of the axilla. Ensure adequate analgesia prior to the procedure. Inspect the extremity prior to splinting and document lesions. Repairing or dressing these is normal. Apply the stockinette to the arm, but beyond the margins of the plaster, and this allows you to fold back. Cut a small hole in the stockinette for the thumb. Apply 2 to 3 layers of the Webril or padding beyond the plaster margins, tearing or cutting as it passes through the first web space. Ensure the elbow is well padded and the Webril overlaps itself by 25 to 50% with minimal creases. Submerge the pre-prepared dry backslab in the water until bubbling stops and then remove. Squeeze out excess water as shown, or a flat surface can be used. Apply along the ulnar border of the forearm and up the arm posteriorly. Prepare the stirrup splint. Apply along the lateral aspect of the arm and extend around the elbow towards the axilla on the medial aspect of the arm. Turn back the padding around the distal and proximal margins of the plaster of Paris. Apply the crepe bandage firmly over the slab and fasten with tape. Gently mould the plaster of Paris to the patient anatomy, palm particularly, maintaining wrist and elbow position until hardened. Use a collar and cuff sling and adjust to comfort. This skill can be seen on the collar and cuff procedure movie.
Some points for this particular backslab. If somebody has a distal humerus fracture or a supracondylar fracture, for example, in a pediatric patient, your plaster will not need to include the wrist, and so your distal margin can just be just proximal to your ulnar. If somebody has a relatively unstable fracture of the forearm, like for example your Monteja fracture, you may consider doing a volar slab as well, or having a sandwich slab, as well as your long arm back slab for more stability.